You stripped your love down to the wire.
ProtoCall has a variety of resources and services that make it really an appropriate organization to link with an online tool. The ultimate vision of what we're trying to create is free online evidence behavioral health solutions for those in need and their family and friends. There's a number of problems right now in the United States that motivate why doing an online system makes sense now. This is from the former director of the National Institute of Mental Health. There's also unmet needs. Mental disorders among children are the most common diseases of childhood. The needs in the child and adolescent population are incredible. If we look at the adult population, 1 in 5 adults in America experience a mental illness, and nearly 1 in 25 live with a serious mental illness. When we look at the treatment, 60% of adults with a mental illness don't receive mental health or didn't receive it when we do surveys in the past year. And 50% of youth aged 8 to 15 didn't receive mental health services in the previous year. Right now, there's again another need for professionals to help families who struggle with a variety of behavioral health issues. The resources for families are really sorely lacking. And if we parse out addictions as one of the behavioral health issues, there's a variety of issues related to the addiction treatment system that makes developing an online system the perfect tool for helping a lot of people. It's kind of like a net. You can see even in this slide that there's a variety of different things that come together in terms of what we're trying to do in an online system. Right now, when people are accessing help, often through a crisis call center, they are referred to community-based resources. But a lot of times those resources are not available. There's wait lists and wait times. Some of the people that would be delivering services are unlicensed clinicians. They're not using evidence-based practices. And in some cases, there's a lot of other barriers like cost, getting to the actual location where treatment would occur, how much time it takes, and incredible fragmentation across the different folks that do this work. So primary care physicians and behavioral health specialists are simply not connecting the dots and talking with each other. Right now, the market fragments solutions. People are complex, and all of their different challenges and issues connect together. So you can go online and get all kinds of apps for depression, anxiety, PTSD, stop smoking, weight loss. And so what's needed is an online solution that connects the dots.
I've seen the darkness in the light, the kind of blue that leaves you lost and blind. The only thing that's black and white is that you don't have to walk alone this time.
And even though there's a variety of other online programs right now, from Prevail to Able to, Life Process Program, My Strength, again, most of these fragment solutions focus on specific issues, but probably more importantly, none of them have the link. Right now is the opportunity because use of the internet is, for the most part ubiquitous. 87% of Americans use it, in a very short amount of time. Most people have access from multiple devices, whether that's smartphones, computers, tablets. The technology is now ripe for being able to do online interventions in a way that we've never been able to do before. Just an example with apps, in 2010 there were 5,000 health apps, and now in 2014, 97,000 in 62 app stores. So the growth in digital solutions is really exponential. There's incredible unmet behavioral health needs in the US. We have widespread internet access, and so there is an opportunity to help millions of people by developing an online platform linked with graduate-trained clinicians that can provide the human touch and the risk management element, as well as the ongoing engagement around interventions, which will improve outcomes. How does that get done? We do that through an online intervention platform we call the 5 actions. the behavioral health solution. And the 5 actions are motivate, evaluate, resolve, manage, and create. All change really begins with motivation. And so the system itself, when people come into it, begin with assessing and increasing a person's motivation for change, essentially motivating them to continue to engage the system. We then do a complete evaluation, a holistic evaluation, where we are screening at a high level a variety of issues and then doing a deeper dive into more structured evaluation that provides us an output of 3 buckets. We take all of the issues from the evaluation and come up with the bucket of what needs to be resolved. What are the acute crisis issues that we need to go after right away? What are the longer term issues in the manage bucket that need management, such as stress, relationships, a variety of issues, addiction, chronic medical issues? All of these things are more chronic issues that need to be managed. And then, unlike a lot of systems that do behavioral health intervention and that focus really on the pathological side of the equation, the 5 action system balances that with the create bucket, where we're also assessing what people need in their life, what optimizes their life, what are their gifts to the world. And that's a unique balancing piece, and a lot of those interventions come out of the field of positive psychology. And the opportunity is that we're able to take that and create a cloud-based intervention system that links with graduate-trained clinicians that can optimize the human touch, and also link up not only with the client resources in different areas, but also using the community and various platforms to access community help. Think about the 5 actions as really a behavioral health operating system, where it's like Windows, and Windows is the operating system, and then all kinds of people can write software that works through Windows. Well, in the same way, we can license and connect all kinds of different apps and interventions for different issues to the 5 action system. So we can take a variety of currently developed, fragmented solutions, bring them into a framework that now creates a holistic solution for clients. And there's a lot of advantage to the way the system works. Again, it's a holistic package of behaviors. By engaging a learning engine and doing a systems evaluation, we can find leverage points for change that are most often missed by clinicians. We're going to differentiate acute and chronic issues so that they go into different buckets. We're not going to confuse those and try and resolve a chronic issue like addiction with short-term solutions, which is currently done in our treatment system with 30-day residential stays. But we're going to be able to really help clients understand what tools do they need, both in an acute and chronic sense over time. We're going to balance it with a strength-based approach from the field of positive psychology, and with incredible data coming into the system, partly because of the leverage with ProtoCall, we're going to be able to really do outcomes like never before and link it with the learning engine to optimize care for patients over time. And we're not only going to treat the patient, but also their family and friends. One example of proprietary content is a craft that's been developed by my colleague Dominique Simone Levine. Allies in Recovery is the website where content is currently available, video-based as well as downloadable workshops or worksheets, different evaluation tools, as well as an online platform for getting help and connecting in a group framework with other people, other families that are trying to get their loved ones into treatment. The idea behind the 5 actions framework is that when people are referred from, say, a crisis call, they get to a homepage that motivates them to start the program. Once they get motivated and they click on a problem area that enters them into the system, they get the complete systems evaluation that then leads them into a more holistic understanding of their issues, but also then links with a comprehensive set of intervention solutions, both online as well as in the community, that ultimately leads to better outcomes. And throughout this system engagement, there is a feedback loop where part of the interventions are optimized by utilizing the graduate trained clinicians for the human touch. One example of how local resources would be engaged is that within the evaluation module, we end up with a problem list of a variety of issues. So in this example, PTSD, depression, obesity, stress, the system itself may go into the local community using Yelp or some of the Google tools and identify a variety of available resources right now that could link with these issues. And so in addition to engaging online content, a particular client may be hooked up with a yoga studio, local self-help group, acupuncture, a gym, a dietitian, and even a counselor. So again, it becomes a very integrated system of online content, graduate trained clinicians with local community resources. ProtoCall, as a company, was established formally in 1992. They're the nation's leading third-party provider of clinical call center services to the behavioral health field. They have 3 different call centers in New Mexico, Portland, and Michigan. They serve over 285 clients. They're EAPs, community behavioral health providers, university counseling centers, managed behavioral health organizations, and they employ now more than 85 master's and doctorate level clinicians. Entering the market and having access, there are people who need this right now. Some of them come from the current clients of ProtoCall. Other clients come from outside of ProtoCall and include healthcare organizations such as Big Bang Health, Zoom Health, and other organizations, government entities such as the military, police, criminal justice, all have needs right now for being able to assess and intervene upon a wide range of behavioral health issues that the current systems, face-to-face systems, are simply not meeting the demand or doing it well. So it's a collaborative team approach. It's bringing a lot of people together, and what we need to do right now is finalize the partnerships, really develop a formalized business plan, figure out what kind of funding we need, and then really go to town, develop the product and start testing it and implementing it in different environments. And then ultimately it gets scaled, which is exciting, and we can do it.